Hey folks, this is Dr. Andy Schneider, along with my great nurse Rana, and this is the 2:30 session, and we're talking about facial fillers. So this is a very common procedure we do. This is something that doctors do with the assistance of the nurses. And I think the first thing to talk about is what are fillers and why do we do them? So something to understand, as you age, you lose volume in your face, and that's part of the reason we look older. And we learn at a very young age how to look at a face and guess the age. And even a young child can look at an adult and kind of figure out if that person is in their 20s or in their 60s, right? That's just something that's kind of innate in our head. And part of that is because we learn that as we age, we basically lose the volume in our face. It's very slow, but that happens over time. And a lot of times people think when they come in for a facelift that just tightening the skin will take care of all the problems of facial aging. And what we know is, yeah, you can tighten the skin and you can get rid of some wrinkles and all that. That's perfectly fine. We do it all the time. It's a very good thing. But if you don't have the volume in your face, you're never going to look quite like you want, correct? So as we see, every day we have patients coming in and we do filler injection. So when somebody comes in for a filler, what we tell them is that they're going to need a little bit of volume. And we look at their face and we say, where do they need the volume? Do they need the volume around the mouth? Do they need it in the cheeks? Do they need it under the mouth? Do they need it in the lips? That kind of thing, right? And we've got this display of fillers here that we're going to talk about in a second. But maybe, Rana, tell us a little bit about the average patient we see who comes in and what they want.
Well, most patients that come in, they're around the age of 25 on up to 70. And generally they come in and they're wanting fine lines and wrinkles to be filled. They're wanting just contouring of the face. They're wanting filling of the areas that they've lost the volume. And so these are the patients that we address.
And the reason we have so many different types of fillers is because they're each designed for different parts of the face, right? Mm-hmm. So let's even backtrack for a second. So everybody's heard of Juvederm. Now, all of these boxes say Juvederm on them, okay? Every single box here is Juvederm. And people say, well, what is the difference? Are these Juvederm? I want Juvederm. Are these Juvederms? Well, basically, every one of these products is Juvederm, and every one of these fillers is actually, in essence, the same material. It's what's called hyaluronic acid. Now, acid sounds scary. Don't worry. We all have hyaluronic acid in our body. And hyaluronic acid is right under the skin. It's what our collagen fibers float around in, so it's a natural product. Sort of like glucose we all have in our body, okay? Now, all of these products are hyaluronic acid, but they're all formulated in a different way. Some of them are thicker, some of them are thinner, some of them last longer, some of them don't last as long. I would equate it to basically looking at something like plastic. We have a general idea about what plastic is, right? We know that plastic, we have pens made out of plastic, car parts are made out of plastic, but that plastic can be formulated in different ways. So it's soft, it's really hard, it doesn't bend or it does bend. So each one of these products is a little bit different, but it's all basically the same structured molecule, which is hyaluronic acid, okay? And if you notice, they all say on here XC. So Juvederm XC, what that means is it's got numbing medicine built into it. It's got lidocaine, okay? So the XC means that once we inject it under the skin, you'll be a little bit numb for a while, okay? So Rana, tell us about how we prepare the patients for a filler. We bring them in the office, we're gonna take a picture of them, but then what do we do?
So we obviously will fully inform you about the procedure. First of all, we will put some topical numbing medication on you. If you would like to have that. And then in addition to that, we will also put ice on you. And that helps with vasoconstriction and that helps with swelling and bruising after the procedure. When Dr. Schneider is injecting, we like to be alongside of him and put a little bit of pressure after the injection. And that also helps as well with the bruising and the swelling.
And I'll pick up on something you just said before we discuss these individual fillers. I think it's just important people to understand you can always get a bruise, right? I mean, anytime you do an injection, you can get a bruise. Doesn't matter what part of the body you get a shot in, you can get a bruise. So I always tell people, when you're coming in for a filler injection, don't do it the day before you're going to a big party, right? Because guaranteed, that's the time you're gonna get a bruise,
Yeah.
right?
For sure.
Don't say, I wanna get my filler injection this afternoon, I'm going to a Christmas party tonight, right?
Yeah.
Give yourself a couple days so that if you get a bruise, it has time to go away, or you can cover it up with some makeup or that kind of thing.
Yeah.
It's just the way it works. Now, all of these products last for a good long time, but they don't last forever. They're
Right.
like anything you inject. They will go away or dissipate over time. Most of these products will last anywhere from 6 to 18 months.
Right.
Now that doesn't mean that at 18 months you're still having the same effect of the filler, because it's going to slowly go away over time. But some of the product will be there, and I always equate it to, say, filling up your gas tank. You may want to fill up your gas tank, but you don't want to let it get empty before you put more gas in your gas tank. You may want to keep it at least half full.
Yeah.
So you have that, so you know you got gas in there, right? And so sometimes when a patient comes in, we'll say to them, you know what, let's talk about how much of these products we need for you. If we've never seen them before, we might do a couple syringes, right?
Right.
Yeah, and some patients, well, let me say this. I think the number one reason people are disappointed in fillers is because they don't get enough,
Absolutely.
right? Isn't that right?
Yeah.
So
absolutely.
if somebody comes in that needs 3 or 4 syringes, but they say, you know, I just want to do 1, they might be disappointed because they're not going to see enough of it. It's like putting 1 coat of paint in the wall,
Yeah.
right? If you really want to get the effect, you need to adequately treat the patient, right? So sometimes a patient will come in and will say, you know, you really need 2 or 3 syringes to really appreciate what these things can do,
Yeah.
okay? And so let's talk about the various products we have, okay? So probably the one we use the most would be what we call Ultra Plus XC. And this has been around for a long time now. And Ultra Plus XC is just a really good filler for a lot of different parts of the body,
Yeah,
right?
it is.
It's kind of our workhorse. There's something called Ultra XC, doesn't have the plus,
Right.
very similar, but most of the time we're gonna use Ultra Plus,
Yes.
right? It gives you a good boost. Another one that we really like is Velour, yeah. So Velour is similar to Ultra Plus, but it's a little bit smoother. And you don't quite feel it as much in the skin, and it lasts a little bit longer, which is nice too. So sometimes we might actually use the two together. Might put a little Ultra Plus in, a little Velour in, mix them up, have a little bit kind of combination of those two. So those are just the workhorse fillers. But then we've got something like Voluma, and Voluma is a little bit more of a powerful filler, and it's really good for the cheeks. That's what it's designed for, what we call the mid-face. So we inject it into the cheeks, and it really does a great job with it. That's what it's designed for. That's when it came out. It was promoted for that. It lasts a good long time, has a lot of lifting ability, and people really love it in this area. But you wouldn't necessarily want to put Voluma, let's say, around the mouth, because it might be too hard and bumpy in that area. But up here in the cheeks, it works really well.
And it's indicated for the chin as well.
That's right.
Yeah.
It can be helpful really around the chin here.
Yeah.
If somebody wants to improve their chin contour, that lifting power is what it really is good for. The opposite side of the spectrum, in some respects, is Volbella, right? So Volbella, it lasts a good long time, but it's designed to be injected very superficially.
Right.
So unlike Voluma, where we inject it very deeply to lift up the cheekbone, this can be injected very superficially, let's say around the lines of the mouth. So if somebody comes in and has fine lines around the mouth, let's say they were a smoker, let's say they just naturally have these lines, this is a great product for this. And it's also very good in the lips if somebody wants just a little bit of an augmentation, but not too much in the lip. And that's something we really didn't talk too much about was the lip, but we see a lot of younger people coming in for lip augmentation, right?
I think that's good for people, like you said, who've come in for the first time and they're a little nervous about putting too much in the lip, and that's very smooth.
Right.
You can start with that, and then you can always come back and do some more of the Juvederm as well,
Exactly.
too. Ultra Plus.
Right, so Ultra Plus, kind of the workhorse, but Volbella, great in the lips, the fine lines, get very superficial. And then we got a new product, and this has only been out for about 3 months or so, called Volux. And this really is designed for the jaw line. So people that sort of have not much jaw definition here, maybe you've got some indentations they want to smooth out their jawline. This is a brand new product, indicated just for the jawline, a little bit like Voluma, and it's got a lot of lifting power, but a slightly softer, so we can do it around the jawline in this kind of area here. So the bottom line is we have a lot of different things to offer people. Now, for you out there, the patient, you don't necessarily really need to know which product you need to use. We'll figure that out with you, okay? What you need to understand though is that pulling, skincare, all these things are great, but nothing makes up for volume loss in the face. And so they go together. And we'll figure out which of these various products is the right product for you. I always tell people this: fillers are for this area down. Botox, which we're not really talking about, is for this area up, okay? So when you have lines on your forehead, you have lines around your eyes, you have lines right here, we don't want to put filler in those areas, okay? There's various reasons why we don't want to put fillers in those areas. We want to keep fillers from this area down. So cheek, around the mouth, under here where people call the marionette lines, in the lips, the cheekbone, the jawline, the chin. These are all ways of sculpting the face. We want to keep it natural though, right?
Absolutely.
We don't want to overdo it, right?
Yeah.
Our belief here is that our patients want to look
Refreshed.
natural, don't want to look crazy,
No.
right? And so we're going to be very conservative with this, which means that we might recommend maybe 2 syringes for a patient, then have you come back in a couple weeks and say, you know what, let's see, do we need any more added?
Yeah.
Because we'd rather kind of slowly get you where you want to be than overdo it at first, right? So Dr. Andy Schneider, we're back talking about fillers. I'm here with my nurse, Rana, who's been with me for 22 years, and I'm sure you've seen her when you come in. And one thing that's great about the filler products, because Juvederm is an allergan company, you get points when you get filler. And I think everybody that comes in here for injection, whether it be Botox or filler or cool sculpting or anything like that, you know you want to get your alley points, right?
Yeah,
so when you get Juvederm, you will get points, and when you come back in, you'll be able to get a discount on future treatments. So now is a great time to call our office. You can text us, you can call us, and come in and get this treatment, because this is a perfect time before the holiday season starts. You know, I'm always thinking about the upcoming holiday season. And I think we're now in September, and Thanksgiving is literally just 2 months away. And these products, when we inject them, will last you through the New Year's, right?
Right.
And so if you're worried about getting a bruise or maybe not liking it, now is the perfect time to get it done. So it's one less thing to think about as we get closer to the holiday season. Because as we said, you know, it's never too soon to start thinking about how you're going to look your best for the holidays, whether it be Thanksgiving, Christmas, New Year's, whatever it is.
Yeah.